What I could say to introduce MUSO Mali project is some key information. MUSO was born from question. And the first question was, what would happen if we decide a different kind of healthcare? What if we could create a health system that functions along compassion, that reaches and treated every patient early in the first moment of their illness? Those key questions lead to a proactive model of care at community level with CHW on the front line as the first contact of the healthcare system. With our main partners, I mean the MOH of Mali, MEDIC, the community, we have designed a community-based healthcare system supported by CHT tools to empower first the CHWs, the supervisors, and second, to organize their daily activities while providing useful information for better decision making. Doing so, we are aiming to end the child and maternal mortality crisis and deliver universal health coverage. To date, our apps have been deployed in 9 health areas, 8 in Bankas and 1 in Euromagi. For men in the management of some pathologies such as children diarrhea, maternal health, malnutrition, malaria, TB, COVID-19, family planning for women and men, and accurate respiratory infection. To date, we have more than 500 users in total at different levels. Level 1 is the CHW level. The second level is supervisor. And the third one, I think this is something new, is the focal point at the facility level. So, man, this is what we can say about the Mali project. At this point, maybe I will give the mic to Gilbert to proceed with this slide. Thank you.
Okay, thank you very much, Ben. The most used feature of MUSO Mali project are the USC mode and the 360 degrees supervision. Let's talk first about the USC mode. The USC mode is that feature of MUSO Mali project that helps people to have easy access to healthcare in order to be helped in time. It helps community health workers to visit households to look for cases such as malnutrition, malaria, antenatal and postnatal care, tuberculosis, and so on. It also facilitates patient follow-ups and helps spread the message for social behavior change. And at a health provider level, it allows health provider to view real-time coverage and know when a household in the health area was last visited. Now, let's talk about the 360-degree supervision. Community health workers are required to produce results in environments in extreme poverty. They are often distant from their teammates. As a result, they receive far less training and supervision support than the other healthcare providers. To address this issue, MUSO and its partners designed and built the 360 degrees supervision. It is a performance management system to support and evaluate a community health worker from all perspectives. It provides a continuous process of guidance, training, supporting, and encouraging the initiative so that they can carry out their work confidently, effectively, and in accordance with directive. This strategy revealed that frequent and quality coaching can critically improve community health workers' performance and quality care. That's it. I let Victor tell you about the previous and the current Mali project contact hierarchy. Thank you.
Yes, thank you, everybody. As you know, connected to the CHT as a supervisor, the supervisor only sees her own supervisor area. But when we are connected as an admin or PM account, Anthony, if you can do click on the slide, an image will appear. Yes, this is what we see connected as an admin in the old hierarchy, all the supervisor area all together. Instead of this, in the new hierarchy, we have the site level. Click, please, Anthony, again. Twice. Yes, here we can see in the new hierarchy the both sites, Girimayo and Bangas. If Anthony can click again, another image will appear, and here we can see in the Bangas side the different health area. A health area for us is the area covered by a health center. If we click again twice, please, it will appear in one health area all of the supervisor area and all the old hierarchy. This is already an advantage of the new hierarchy, since it's a better logical organization. But really, this is not the main reason for the new hierarchy. One of the main goals of the CHT is to guide community health workers to follow medical protocols when providing health care. Sometimes the cases found by these community health workers are serious enough, so they need to refer the patient to the health center. Once in the health center, we are out of the area of action of the CHT. With the old hierarchy, we cannot do follow-up of patients with the CHT. Yes, even in the health center that has some hospital information software that can really well interoperate with the CHT, we have had a lot of troubles. Mainly, the power electricity supply is a trouble here, and the internet connection stability. So we have seen at MUSO that we need a device that is easy to maintain always on, and an application that can work offline. So MUSO wonders why not use the CHT at the health center level. This is the main use of the new hierarchy. With the implementation of the CHT protocol, we have added a user at the health area level. This is a person who works at the health center physically with the CHT application, and that does the follow-up of TB cases with the CHT task that remember when he has to do the follow-up and the form and CHT forms. The supervisor and the community health worker are notified once the patient is back to the community level, if he's at his household or his family. So the healthcare can continue with the CHT once back in the community. For finish this, we have added a site level. Actually, we are not using really the site level, but as the same way that community health works sends or refer patients to a health center also send patients to district hospital. We don't know if we will use this level for the following up of patients at this level, but it is probably, maybe, we will need. So at the same time, we have at this level to the hierarchy.
All right. Thanks, Victor. So I think we'll move to the technical plan, and in case you have any question, feel free to put your question in our chat. We'll be able to deal with that question after this session. I would like to invite Bino to take us through the technical steps involved in changing the hierarchy. Over to you, Bino.
Thank you, Anthony. So yeah, moving the hierarchy is, or changing the hierarchy is not a straightforward task in CHT, mostly because of the technology that we use, which is CouchDB, and it's a NoSQL or a document-based database system where everything is stored as a document in the form of key and values. So you may know it earlier, the documents, the main types of documents that we have in this app are either contacts, reports, tasks, everything is a document. So in order to move a hierarchy, we need to move or update all the contacts and the reports that fall to the area that is being moved. So it involves a lot of planning and preparation, and the friends at MUSO might know like how difficult it might have been to prepare at the field level. So and this was the steps that we followed. Like we had a list of areas that we wanted to move, and one thing that I wanted to make clear is like this was not like we moved everything at once. We made it gradual. Like there were something more than 30 supervisor areas that we moved one at a time. And before the migration, the requirement is that all the users that fall in the area that is being moved, they need to synchronize, since they have documents that might be stored only offline, only in their devices. That needs to go to the server first, so that afterwards it is not missed, like it does not remain in the device only. So the first step is to do the synchronization, and they need to log out from the app and to make sure that there is no conflict afterwards. And the users that are affected by this move, they have to reset the app. That means the app storage, your Android device needs to be clear. So they sound like starting as a fresh app. So the instructions were provided, which were duly followed. And meanwhile, at Merit, we prepared by configuring for the new hierarchy as well as supporting the old hierarchy. So here by parallel hierarchies, I mean, like since we were only gradually moving areas around, so we had to, for the transition period of, I think, 3 months, we had to support both hierarchies at the same time, the old hierarchy that you saw in the left and the new hierarchy. And the configuration involved like changes in the forms and changes in the task, and also in the analytics side. And we practiced moving by cloning the server and doing moves around so that we got familiar with it. And you can go to the next slide, I think. So at the time of actual migration, we run the tool that is CHT-conf. I will come back to it later in detail. It took, depending on the number of documents or contacts and reports being moved, it took anywhere from 4 hours to even 1 day. So this tool that we have, we had from CHT conf tool. So using this tool, we moved the contacts and reports. And during that time, the users, the supervisor and the CSWs that were being moved were not able to use the app since they had already logged out. And in case they had to do the assessment, they had to do with paper-based or other methods. But it was planned that way, planned from a long time ago. Maybe that was not needed. Yeah. So I'll come back to the the technical steps taken during the move in the later part. So yeah, we can go to the next slide. After a supervisor area and CSWs under it and all the reports and contacts under it were moved, now the users were asked to log into the app. And this time the login would take a very long time because all the documents that were in the server and that belong to those users had to come back. And it took almost 24 hours, if I'm not mistaken. And there were some hiccups, and there was also some problems that were identified and fixed later to make sure that the users can synchronize, and other users who are not part of this move at that time, they need to be able to use the app as normally. So we had decided that we'll only plan to synchronize 100 users at a time. So the total days of inactivity for CSWs was 2 to 3 days, unless there was any other problem. We can move to the next slide. So these are the steps, the technical steps that we took to move one area at a time. And going from the first part, like since we are adding 2 new levels at the top of the hierarchy, we had to clear those places first. They would be empty at the beginning. And actually, when we are doing this move, we're also editing the data or the metadata, which is used to identify the contact type to move from the default hierarchy, the old hierarchy, to the new hierarchy. And we also edited or modified the type. So in the second step, like the type of the area to be moved, that was changed. And we run the move command, which I have linked the tool here that was used. It is using the CHT conf tool, and the command we run is CHT move contacts. The actual command is a little bit longer, but this is just a part of it. And in order to edit the contacts, we need to create the list. For that, we used a Python script to create a CSV file, and we modified again with the CHT edit contacts. This is also a CHT conf tool. And after everything is complete, only then we upload the documents. So until now, we only get the documents from the server to the client, and then we make changes, and then we upload. And we check the log for any error, and if we find any error, we investigate whether there's a conflict, there is a failure, and to make sure that there is no disruption, we ran these all commands from a server. And as I had added here, like the points that are like change the type, clear the list, and edit contact types, those are only needed when you are also editing any metadata while moving them. Otherwise, for simply moving, we don't have to do these 3 steps. So to continue with this, I'd like to invite Marina.
So as Binod and others have mentioned, for this project, we needed to do a specific preparation on the field with the partner. As before the move, the users needed to synchronize and log out before we do the move. So we had to do the synchronization on the field. So one of the challenge was that the partner had to do a preparation, specific preparation on the field to inform all the users who are concerned about the move to stop using the app before we do the move. And part of this challenge was also that we needed to solve as mentioned earlier, the moves were done progressively. That is, we moved to one area before going to the other. And in this case, we needed to adapt the scripts and the configuration that was already in place to make sure that no matter in which hierarchy a user is supposed to still get his app working. So for example, we had a dashboard that was running around this hierarchy, and the new hierarchy that we created, we renamed the place types. So we needed to adapt the changes. One other challenge is that we wanted to avoid any disruption in this move. That's why we make the choice to do the move from the server. And because we did it from the server with the custom script in Python that Binod mentioned, each move that we did took around 4 hours. Minimum 4 hours. Some of them took even a whole day to do the move. But we were monitoring as the move was ongoing. And on the user side, after a move of an area, each user had to log in, and then he had to spend some time to have the app synchronized back and get his data. And the minimum hour that it took for each user was at minimum 24 hours. So during that time, they were not working. They had to wait for that time. Another challenge was that we couldn't do many moves at the same time to avoid the server to be slow. That's why we needed, after each move, to let some time for the users to synchronize, make sure that everyone has synced before we do the other move. This is one of the challenge. And another one was a large number of documents that was noticed from one of the users one of the users that were at the high level. For example, the TV focal point, we noticed that some of them were having more than 30K documents to sync because of the replication depth that we set there. So we had to do an aggressive purging to have them delete all the unwanted documents from their device. So one of the challenges that is not mentioned in this slide, I think it was left out, is that we had to also deal with wrong places. For example, we noticed that there were some places that were created at the wrong places. For example, you will see a household that has been created on the CHW area. So during the move, it didn't have any impact. So we noticed that we are having in the new hierarchy some places with the wrong type. So we had to do some workaround to be able to put them in the right place in the new hierarchy. The TB workflow has been implemented, and about 600K contacts were moved, and around 9,000K reports moved in 26 batches. And that took about 2.5 months to do that move, based on the fact that we had about 30 supervisors area to move. And currently, the app is at the health center level. The users are able to use the CHT, but before the hierarchy move, they couldn't do it. And now we have new workflow that have been added to the app, and more can still be supported. And one thing is to highlight is that we have now a level of an app of 5 level of hierarchy, but we have one spare level at the top, the site level that is not used and can still be used in case there's another new workflow or a new requirement that comes in.